Just for a minute, imagine that Boris Johnson was watching this, okay? As a nurse on the front line, as a human being, what do you want to say to the government? What do you want them to do for you and your colleagues?
I'd want to say, just don't forget this.
When you got told that you were going to be in 2 days going onto the COVID ward, what was your thinking, your feelings?
I was just quite anxious and frightened, I guess. I wasn't actually too bothered about the fact that I would be working with COVID at all. It was more, like I said, that I was being asked to go and work on like a totally different job to what I normally did. We didn't get any training or anything like that. We just had to kind of get on with it. So it's just really frightening because obviously as a nurse you are responsible for what you're doing. So it's quite a thin line between doing something that you don't know and doing something that you need to do because the public need you to do it.
Take me through your daily shift. When you've been working there, kind of what does your shift consist of? We
turn up to do the first part of the shift where you would turn up and go to an area that they've dedicated as like the on area, which means putting your PPE on. So there's a room that's dedicated to doing that. So you get your scrubs, you put on all of your PPE. You then queue up in that room to find out what patient you'll be looking after that day. Once you've done that, you then have to go through security, who makes sure that you've got all of the PPE on that you need to have to get through. You then take a designated lift up into the intensive care floor, because it's not a ward anymore, it's the whole floor that's been made into an intensive care unit. You then make your way straight to that patient that you're looking after. You get a handover and then you're with that patient for the rest of the day until you go home.
Having one patient dedicated to you per day, do you feel that there's a real great sense of responsibility and also get a personal relationship with that person as well?
It's a massive responsibility. I mean, we do have intensive care nurses that are intensive care nurses that in a reasonable distance away that we can ask them questions if we get stuck on things. So you're not completely on your own, but it is still a huge responsibility, even just looking at the machines and something basic like a set of observations that I would know how to do on my ward. It's like totally different where I am now. So knowing when to escalate what is quite difficult. And then in terms of the relationships with the patients, it's quite odd for me because where I am from, our patients are with us between anything from like 6 to 10 weeks. We get to know all their family. We know them really well. We quite often stay in touch for like years after. Whereas these patients, we don't know any of their family because no one can visit them. And pretty much all of them are under sedation. So they're technically in like a coma sort of thing. So you're not talking to them or you don't know them. You only know their date of birth and their hospital number and how they presented in intensive care. So you don't know the person really at all.
How does it make you feel, you know, that atmosphere where they're under sedation, you know, there's no friends, there's no family coming to see these people, it's just you and your colleagues. What's the atmosphere like?
I think it might sound a bit harsh, but because you're there to do the job, and there's, especially for someone like myself who isn't experienced in intensive care, there's a lot to remember for me to be safe. So the sort of emotions that come with a scenario like that, you have to sort of just put them aside because you need to remember what you're doing and really concentrate on what you're doing. So it's a sense of teamwork on the ward, because you've obviously got the ward nurses like myself, and then you've also got the intensive care nurses, and we're all kind of trying to work together to get through this. So it's a good sense of teamwork, and there isn't what people might imagine it to be, like quite like sullen and everybody's really sad and miserable, because you just couldn't work like that. It's not sustainable.
There must be moments where you do have a bit of reflection, right? I know you're on the go the whole time, the shifts, I know from what you've told me, from what James, your fiance, has told me, they are massively long shifts. But when it comes to the end and you're on the train home, there must be a real sense of reflection. That must be where it's hard, right?
Oh yeah, definitely. Yeah, I cry all the time.
In terms of your sadness, obviously there are very clear reasons why you're sad. But is it about the things that you've seen, the situation that you're in, or?
I think it's a mixture of being really, really stressed, and feeling like I haven't done a good job. It sounds really mean, but it's really, because of the situation the patients are in, it's really hard to bond with them. So I would call it like shocking what you see. I remember when I first did my first couple of shifts there, I was really, really shocked, because you can't recognize anybody because of the amount of PPE that they've got on, and all the patients that you're looking after are really quite sick. It looks like something you can't imagine. Yeah. So leaving it's almost like all this like pent up emotion that you have whilst you're on shift, the stress of it, the like, you don't know where anything is, the person you're looking after is really poorly and it's really sad, everything like that, and you just like after. And
since another question is coming in here about you saying that you didn't feel properly equipped, has the government helped in any training since? Nothing.
No, it's very difficult because they needed the nurses like now. So it's very difficult to give anyone any training when you need them to work now. Where I've been the intensive care nurses that are with us have been brilliant, and they're trying to help as much as they can, but obviously they're very stressed as well for different reasons, having to try and support us. But in terms of government help, from what I know, there's been nothing.
You being sent home during this week, I think more than anything, it's a reminder that you're not superhuman, you aren't immune from this, and that you can get it too. So talk to me about your symptoms and how that was addressed by your bosses.
So I essentially woke up, I had a really restless night, like really hot and cold all night, and I put it down to stress of having to go back to work because I'd had like 3 days off. So it's always hardest to go back to work when you've had a little bit more time off. But I ended up waking up at about 4 or 5, thinking that I couldn't go in, I didn't feel well enough. And I had this weird jaw pain as well, which I didn't know what that was. I ended up ringing 111, and they told me that because I had a temperature and I potentially had like sinus issues as well, and felt a bit short of breath, that they were going to recommend that I'm off for a week. So I just let the matron of intensive care know, and my manager from my previous job, who were absolutely fine, and said to let us know on day 6 how I was feeling. I then got a call from the occupational health department yesterday, who said that they booked me in for a test. So this morning I went and got tested. But essentially, you just walk into a room, you swab the back of your mouth, you swab as far up your nose as you could possibly go on both nostrils, you double bag the sample, write your name on it, and then somebody sends it off for you.
And then when do you find out?
They said 1 to 2 days.
Right. Okay. And you and yourself, considering that you've dealt with people that are showing symptoms, do you think that you've got it? You don't?
No.
So no. You think it's precautionary that you've been sent home on a precautionary basis rather than?
Yeah.
And they can't take these things lightly, you know. Were your symptoms in line with the symptoms that your patients have had, or have they all shown different symptoms?
So all the patients that I have been looking after have had very, very similar issues. So a lot of them presented to A&E, and then was sent home. So they presented to A&E with shortness of breath and a fever. A&E sent them home, and then 3 or 4 days later they came back in quite a critical condition. My hospital doesn't have an A&E, so all of our patients have been transferred from other intensive care wards within the trust. So they were moved, so they presented to A&E, went home, came back in a worse condition, ended up being intubated, so I had a tube put in to help them breathe. at that whatever hospital that they presented at, and then they were transferred over to us at a later date.
And I mean, the fact that you've got these symptoms is awful, just as it is for every single person that's suffering with COVID-19 at the moment, all across the world. It's awful. But there's a lot of talk about the lack of PPE at the moment. We see it on social media. There's been stories of people sharing masks, sharing filters. What's your view? I can see the smile, your view about the PPE situation.
It's just the idea of sharing a mask.
Yeah.
I haven't had any problems with PPE. I have quite a lot of friends in other trusts doing nursing and paramedic and that kind of thing. And I've had some stories from them that they have had problems, but I personally haven't had anything. The worst we've had is there's been a massive increase in needing to wear scrubs, because obviously we can't take uniforms home and wash them at the moment. So there's been a shift I've been on where we've had to wear hospital pyjamas because they've run out of scrubs. But other than that, in terms of masks and goggles and all the rest of it, the PPE that I've had has always been there. Most
importantly, I just wanted to ask you, I know I've said how you're doing with the symptoms, but how are you doing in yourself?
I'm okay. I think the hardest part of it all has been, like I said, going to somewhere where we don't know and being expected to do something that you're not sure of in really horrendous conditions. It's really hot there, so I don't think I've mentioned that, but oh my god, it's so hot. That makes it quite difficult. Just because the intensive care ward has been expanded into normal wards, so where most of the time the reason you go to intensive care is because you've got some form of like organ failure and you need a machine to support that organ. So the wards that they've been sort of made into different intensive care wards aren't designed to have all these machines in them. So the wards in general are really hot, and on top of that you've got a hat on, goggles, a mask, a plastic apron, plastic overshoes and gloves on. And then if anyone's ever been stressed before, for me anyway, it makes me really hot. So having a hot environment with all the stuff on and then being really stressed as well, it's hot.
When you kind of come out, that should be your chance to relax and try and de-stress, as you say. But you've probably got the issues of having to stay healthy, trying to get food. How have you found that, given the pandemic?
I've been really lucky. I live with my partner, and then I've also got lots of friends and family that live close by to me. The people I do really feel for is there's so many nurses that we have that come from the Philippines or come from Ireland or Italy, Spain, that are literally here to work, and they don't have friends, they don't have family. They quite often live with a house of nurses as well who are doing opposite shifts. So from speaking to a lot of them, they're quite lonely and they haven't got people to be there to pick them up or people to go and help them with their food or anything like that. So it's those people that I really feel for.
Have you found that that people are ever more grateful for the NHS since this has happened? You know, the clapping every Thursday evening. How does that make you feel?
Yeah, the clapping, it makes me feel quite overwhelmed and almost like a little bit embarrassed. It's really nice because although I've been nursing for a while and my family and friends have always been like supportive and appreciative, sometimes it feels like you're fighting an uphill battle with like staffing and funding, so you can almost feel quite down and like downtrodden sometimes. So having people out there and clapping and like being behind you, it's really lovely. Because I would honestly say that although it's like a different situation and it's stressful in different ways, I'm not working any like harder than I ever have done. So it's really nice to like feel like people are like, yeah, you've got this. It's nice.
Well, the one thing I'd say from that is you've got absolutely nothing to feel embarrassed about, as you say, because I think I speak on behalf of everyone when I say that you are incredible, and so are all of your colleagues as well. And these are what people have sent in actually today and throughout the week as well. So first up, from Will Hone, he says, how are you finding it as an actual person having to sacrifice yourself for others? Are you still able to put yourself first and make your own life decisions?
That's a really hard question. I think it's quite hard to say that you can put yourself first when you're actually like at work doing it, because you almost don't have a choice in a way. You can't just say, right, I need a drink, I'm gonna leave. Like, it's like the little things like that. But I think this isn't, I don't know how to word it. Like, we've coped with stuff before, and this isn't that different. I think the biggest thing for me is just the conditions that we have to work in. But we've done stressful situations, and I think we can do this one, hopefully.
I think on a personal level, obviously, as I say, knowing you as I do, you're being very brave there, because you have a wedding coming up. That's a big thing that you should be thinking about. You've got an incredibly brilliant best man at that wedding as well, obviously. Don't know who that could be. But that's a big thing that you would normally be thinking about. And you know, you haven't been able to put your focus on that because of you're putting your focus into other people. I think that's incredible. So thank you. Just for a minute, imagine that Boris Johnson was watching this, okay? As a nurse on the front line, as a human being, what do you want to say to the government? What do you want them to do for you and your colleagues?
I'd want to say, just don't forget this, because I think the government have had to address this problem because it's so wide scale. And compared to how they've addressed other problems, I don't actually think they've done a really terrible job. I know absolutely nothing about politics, so it's just like my own experience.
Yeah, go ahead.
But from my experience, the NHS has so many problems, but all these problems are just on a smaller scale. So like, I've had so many days on my normal ward where we turn up and we're like dangerously understaffed, and there's always this famous question that our managers ask us, and I'm sure their managers get asked by their managers, is, are you coping? And it's like, yeah, we're coping, but the problem isn't being addressed. And unfortunately, that problem can only be addressed by the government, because there's only so much people on the ground can do. And I think hopefully the government sort of thought, well, we've got an NHS and we need to keep it and look after it, because at the moment the NHS is just coping because it's relying on people getting by, because you can't just turn up today and think, oh no, I'm not going to do this, because you've got to look after the patients. So I think I'd just like to say to Boris Johnson, just remember this and try and help things that are happening that you're not helping at the moment.
If you've been inspired, if you want to help out the likes of Jess and her colleagues and her, everyone that's working in the NHS, then there is a donation link on my bio in my Instagram. It's for NHS Charities Together. It's an incredible cause, so please do donate. I know everyone's been doing their bit, so there's no pressure. But if you do feel inspired today, you can just click on the link and then make your donation. And also remember, if you know someone who is a key worker, maybe it's yourself, a family member or a friend, whether you're a paramedic, a police officer, a social worker, maybe a postman, binman, you're all helping us here today, just like Jess. So just DM me, and we'll try and do this again soon, because it's just incredible to hear from the likes of Jess and all of you key workers out there. So thank you very much for watching. And Jess, thank you for everything you do.
No worries, thank